And I want to thank everyone who was in attendance this afternoon or this morning, depending on where you are in the country. Um, this is very important, understanding the statistics um, about prostate cancer, and then separating the statistics and diving deeply into it. So first, what I wanted to do, I'm going to share my screen with you. And really, what we want to understand in this segment, and what I'm going to present, is really understanding the trends of these new cases of prostate cancer between 2000 and 2025, because you'll get an idea of where are we going. So first, at a high level, when we're talking about trends, these new cases that between 2000 and 2005, at one time we had a peak and then it started to decline. So if you go back to the mid 2000s, there was a sharp decline between two.
Thank Keith. Can I
Yes.
interrupt for a quick? Can you please go into slideshow mode?
Okay, is that better? Thank you.
Excellent. Thank you.
Okay. So and yes, you have a better view here. Yeah. So what I want you to understand is that back in the mid 2000s, there was a sharp decline, especially between 2017 and 2014. And this decline was about 40%. And then the annual cases started to increase about 2014. And when we'll hear more and more about why this increase began, but we just want to see the numbers. Between 2014, there's been this 3% increase annually. And I'll show you, give you some evidence where with advanced disease, it increased 6%. So the point is that now, since 2014, there has been an increase in the number of prostate cancer cases. Now, the American Cancer Society, on a yearly basis, predicts or estimates how many new cases there will be for major cancers. In this case, we're looking at focusing on prostate. To the left, we'll see prostate, breast, lung and bronchus, and colorectal. And what you'll see is between 2019 to 2025, the American Cancer Society's predictions increase, but they're not increasing at the same rate that you'll see with breast, which was 18%, lung and bronchus, which is 0.7%, and it's on decline, and colorectal, which is about 6%. This is alarming that there's an 80% increase in prostate cancer predicted in 2025. And there are groups that are predicting that we will have doubled by the end of 2026. Now, to kind of simplify all this data, we have a tendency to generalize, group everyone together. And that's a good way of looking at the numbers. But when we live in a diverse society, we need to take a closer look. So if we look at all the groups that live in major groups that live in the United States, and we're looking at prostate cancer, and if we start at this graph to our left, in 2003, the number of cases were 202,000, I'm rounding it off. And by 2022, it had increased annually to about 250,000, 55,000. This, if you just look at all the groups together, it's only about a 2.6% increase. And that's not shocking at all. That's an acceptable increase. And then if you break it down and look at Caucasian Americans, you'll see cases in 2000, about 13 to 2022. Now the next
Keith, your audio is going in and out.
Is it there?
There you go. Okay.
Okay. So to kind of,
And start sharing your slides again. For some reason, they're not sharing now. Sorry.
um, are we back? Okay. So now that we have an idea of, we're looking at these numbers, let's just take a look at the percent of prostate cancer cases by stage. So when we say stage, stage is localized. That means the cancer is confined to the prostate. Or regional, that means it's around the prostate, but not inside the prostate. And then distance. And the term that a lot of people are familiar with is metastasis. And so what you'll see is 69% of the diagnoses are localized. Regionally, about 14%, and then distant is about 8%. And then there's this unknown, unstaged population is about 9%. Now, this is important because we want to understand that survival is based upon where your disease is diagnosed, your location. Now, the 5-year survival rate can be as high as 97% for prostate cancer. But if you look at the 5-year survival rate in relationship to location, it's almost 100%, or if not 100%, if it's diagnosed locally and regionally. But then we have a stark drop from 100% to about 38% in distance. And then the unknown category we won't touch upon. But the most important here is if it's diagnosed locally, the 5-year survival rate is about 100%. If it's diagnosed locally or regionally, the numbers are still high at 10 years. But again, look at what happens at distant metastasis. So at 10 years, you may be above 96%, whether it's local or regional, but you drop down to about 18% survival if it's diagnosed in away from the prostate. Now, let's look at just the rate of new prostate cancers per 100,000 men. And this, generally speaking, this is just this incidence rate. If we look at, again, remember when we said we generalize, have a tendency to generalize, we'll see that all races, it's like 120 per 100,000. And if you look at the Hispanic population, that's about 90 per 100,000. The non-Hispanic, or American Indian or Alaskan Native, that's about 82 per 100,000. Asian and Pacific Islanders, about 64 per 100,000. Now, the major ethnic groups with the highest cancer rates are non-Hispanic Black and non-Hispanic White. Non-Hispanic Black is 194.8 compared to the non-Hispanic White, which is 118 per 100,000. So these numbers are very important because you'll see that there are other ethnic groups that are suffering from prostate cancer, but their incidence rate are below. Now, if you take a look at what I originally spoke to you about why it's very important for us to screen and detect prostate cancer early, is because we're starting to see this in late stage disease. So let's just take a look. If people look at people of Hispanic ancestry per 100,000, Asian ancestry about 7.3 per 100,000. But again, people of African ancestry, about 21 per 100,000 compared to that of white, almost double that of people of European ancestry. And what did I say before? We've recognized prostate cancer increased 3% annually since 2014, but it's 6 to 7% annually when we're talking about advanced disease away from the prostate. Now let's look at mortality rate, the death rate associated per 100,000. Now, what's something that I wanted to point out here is that, again, if you look at all races, that means we've generalized, combined everybody. The incidence is about 19 per 100,000. But what was interesting is this: the non-Hispanic American Indian and Alaska natives, they're 18.9. It's comparable to that of Hispanic whites, even though they were lower, had a lower incidence rate. Now the mortality rate is higher, and then compared to people of African ancestry, non-Hispanic Black, it's 36. So again, this is consistently what we've seen for decades, that this two times mortality rate compared to other groups. And I wanted to just take a step back. You remember we talked about this concept of generalizing. You can generalize when you talk about race, and you can generalize when you talk about age. And what I want people to recognize, if we break it up into these different age groups and we look at the incidence at age, you'll see that this higher ratio, the incidence rate is extremely high, especially for Black men between ages 40 and 44. It's a ratio of three, a 3 times higher rate. Now, this rate starts to drop as you get older. The rate starts to drop until you get into your 70s, 80s, and 90s. Now, what's interesting here is that we just stop here at 65, ages 65 to 69. We'll see this incidence rate is extremely high, and it's almost twice, double that of Caucasians. Again, it's still high. But the point that we wanted to bring up is, and I wanted to alert everyone is that this incidence rate is extremely high in African American men at younger ages. That's why it's extremely important for us to begin that discussion about early detection screening at 40, because Black men are at high risk. And then these are mortality rates. And consistently, what I found very shocking is that the mortality rate for Black men, even though the numbers are small, we have ratios of 5 times greater death rates between 40 and 45, and over 2.6 times death rate, over 2 times death rates at age 45 to 49. That's why we need to be extremely careful when we start grouping races together and grouping ages together, because we really need to stratify, need to look at different categories, because we see the numbers are extremely different and alarming. So kind of our take-home message here is that we look at the incidence rate and the mortality rate in Black men. It's getting higher. The incidence rate is 191 compared to 114 white or Caucasians. And the mortality rate, again, is consistently about 2. I wanted to thank you for taking the time and listening to me review the statistics, and I will pass it back to Tom.